like conflict of interest, I don't have any conflict of interest. So just because there's some figures we need to, you can say like with the copyright and etc. So these are, some figures are not mine. So these are, I have taken from these books which I like, because I like were more informative. And there are some short videos and radiology images which are patient consented, and that's what I will put it on. Okay. So first of all, I think if we see that the kidneys there, everybody knows there are two kidneys, sometimes there is a one kidney, they are retroperitoneal. Imagining such as like what's that internal arrangement is, will make you better, you can like do your procedures, whether you do the percutaneous approaches or endoscopy. So kidneys are lying retroperitoneally, so the upper poles are going towards medially and then posteriorly, and the lower poles are anterior and laterally. So if you see movements like this, so the kidneys are like this. So particularly when you are having a supine patient, so you can see the lower pole is up and slightly lateral, so that can give you more idea that how you will be approaching things. And in the prone position is slightly different. So other thing, importantly, the kidneys are not like you can say like when we see in the IVU or some X-rays, they are not like in two planes. So they are slightly curved anteriorly, 30 degree, so that actually the calyx is faced slightly anterior laterally. So that's one important point. That's a practical application. Secondly, if you see the positioning of the kidney, you know that the right kidney, because there's a lever, so it will be slightly lower. Left kidney slightly higher. So these are the landmarks like L1 to L3. This is the rough area for the right kidney, and the left kidney is T12 to L3. But every time the position is slightly different because of the patient movement, body posture, and particularly when we are doing the surgery, anesthetic, their respiratory movements make it difficult. So normally it's a 3 centimeter, you can say like movement up and down, and that you can say like you will appreciate when you're doing the endoscopy. So sometimes it may become challenging to you can say like do the ureteroscopy. Second important point, if you see that, because on the right is the that's like the right kidney on the left, because it's the posterior view. So the kidneys, if we see that the right kidney is under rib 12 and the left kidney is between 12 and 11. The important things are in these areas, the pleura and the lungs, they come over the kidneys. This